Pittsburgh, I believe, is a unique community in many ways. Many people know it as the city of bridges, and what we feel we are doing in these faith health initiatives is building bridges across disciplines, across communities, and across faith groups to address the well-being of communities.
One of the interesting things about Pittsburgh, our topography really defines us in terms of who we are. We're a valley community with hills all around it. Unfortunately, a lot of the at-risk communities, public housing, for example, in this city is built on some of the most inaccessible hilltops and mountaintops around. While we have no shortage of availability of healthcare services, the issue of 100% accessibility is a challenge for us.
An agency such as the Community Care Network in Pittsburgh has been able to get through their religious ties into church populations and have used those people who are part of the faith-based community to go out into the broader community in which they live, to get people to come in and to get them appropriately screened and educated, because really the goal of public health is education.
What's unique about the Coordinated Care Network is that a series of spiritually based organizations together with community-based organizations as well as federally qualified health centers came together not just in an informal way, but were willing to clinically coordinate their programs, make them managed care friendly, and then offer them back to the insurance community as well as to medical assistance and Medicare as a way of reaching the most vulnerable people in our population and bringing them into the mainstream of care.
We've been able to show that through a coordinated system of care, we can decrease utilization of hospital days as well as utilization of the ER, which a lot of people use as kind of their primary care center, which in the end will help to save managed care companies dollars.
We took traditional public health where we had been a top-down agency and said, this is what you should do, and involved the community, and gave them approximately $5 million a year and said, here is the budget that we have to deal with. You help develop a plan that will address the issues in your various constituencies and communities.
The Coordinated Care Network has 180 psychosocial spiritual intervention programs that are offered out of 60 sites throughout the city of Pittsburgh.
We believe that faith-based organizations have a special commitment to the community, to people, to a more integrated approach to care.
Our original idea was that we would deliver services to people out in the community, and what we came to understand is that they wanted skills. They wanted to know how they could care for themselves. By training people with some technical information, how you eat, when and how you exercise, smoking cessation techniques, whether or not you take your medications, whether or not you get appropriate testing and monitoring. They were able to use the church basis, its way of helping its congregants, and they're able to use those techniques they already knew to develop very effective programs.
A holistic model of healthcare combines or integrates physical health with mental health, with social health, with spiritual health.
Working through a faith-based organization reaches people that may not be connected in any other way to health care. They may only trust their church to help them.
Parish nursing is a partnership between a hospital and a faith-based community. And what's wonderful, I think, is not only do I serve the people in the church where I practice, but I also serve the people in the surrounding community.
For issues like this, we have to reach at the highest level. And 100% accessibility, I think, is something we have to keep in front of us, and we move towards it. That's the kind of people we are. We're called to that very high standard, and I wouldn't accept anything less.